gastrointestinal pharmacology. Pharmacology is very, very important. You have to remember each and everything about pharmacology. But like I said, pharmacology is volatile. So you have to do it again and again, but keep it in the end, 1 week before your exam, because if you know pharmacology, you can answer all the questions right. And that will ace your score, and your passing chance will be very, very high if you know pharmacology. So first is the group of drugs H2 receptor antagonist. And the drugs are cimetidine, famotidine, nazatidine, ranitidine. So this group, antihistamine, H2 receptor blocker. So what is the mechanism? They block H2 receptor, which causes decrease in acid secretion. So we already know. So we have stomach. We discussed the physiology. We have parietal cells. We have G cells here. G cells, they actually act on enterochromaffin cells, which will release histamine. Histamine will act on parietal cells, which will increase acid secretion. So if you block histamine here, you will decrease the action of histamine on parietal cells. So loss of acid. So what is the clinical use? If someone has peptic ulcer disease, gastritis, acid reflux. So, but this is not a drug. So the common side effect, which you will see in the hospital, which is one of the reasons we try to avoid this drug, they will ask you about creatinine. Cimetidine can decrease renal excretion of creatinine, and creatinine, the kidney number, marker of kidney injury, it can go high. The other common side effect they will ask you is anti-androgen. It will increase androgen in the body. Anti-androgen, so increase estrogen. So it can lead to gynecomastia in male. The other most important point is cimetidine is potent P450 inhibitor. So it can affect the metabolism of other drug. So first group is H2 receptor blocker, cimetidine, famotidine, ranitidine, nazatidine. Next group is PPI inhibitor, proton pump inhibitor. We have pantoprazole, omeprazole, lansoprazole, dexlansoprazole. So what is the mechanism? So we have stomach and we have parietal cells in the stomach. So in the parietal cells, we have hydrogen potassium ATPase pump. As this pump is working, the hydrogen will be secreted into the stomach lumen, combined with chloride and form hydrochloric acid. If you inhibit this pump, hydrogen will not be excreted into the stomach lumen, and that will result in decreased acid production. So what is the use? Used in peptic ulcer disease, gastritis, Zollinger-Ellison syndrome, as a part of triple therapy with H. pylori eradication, stress ulcer prophylaxis, especially in patients who are intubated, who are on bed. Because you are suppressing the acid with this group of medication, you are suppressing the acid. No acid, so gastrin level will go high. So this is one of the side effects. It increases gastrin level, hypergastrinemia. It increases the risk of Clostridium difficile infection. How? Because when you suppress acid, is basically a protection from foreign bodies too. So if you suppress all the acid in the body, then risk of infection will go up. So that's how it increases C. diff infection. It decreases the absorption of calcium and magnesium, which will result in low calcium and mag level. When the calcium and mag is low, especially calcium, it increases the risk of fracture, osteoporosis. It increases the risk of pneumonia and interstitial nephritis. It can cause AKI. It's very common cause of AKI, interstitial nephritis. Next is antacid. So what are the different antacid we can use to neutralize the acid in the body? We have mag oxide, calcium carbonate, which is famous as Tums. Patient will ask you all the time. Aluminum hydroxide. So basically they neutralize the pH. They neutralize the acid. They will alter the absorption, bioavailability, and urine excretion by changing urinary pH. All can cause hypokalemia. Okay, whenever there is a magnesium you are giving to the patient, magnesium will cause diarrhea, hyporeflexia. If magnesium deficiency is severe, it can cause cardiac arrest. Calcium carbonate, you are giving calcium to the patient to neutralize the acid, calcium carbonate. So that can cause increased calcium, hypercalcemia, sometimes rebound acid reflux. Aluminium hydroxide, so magnesium level will cause hyporeflexia. Aluminium will cause hypotension, low phosphate, proximal muscle weakness, and increases the risk of seizure. So these are the common medication you can use in antacid group. Next is bismuth subsalicylate and sucralfate. So sucralfate is commonly named as carafate. What is the mechanism? It binds to the base of the ulcer and protects the ulcer from acid damage. It needs acid environment to function. Therefore, it is contraindicated with H2 blocker and antiemetic. Common use is in healing ulcer. Next is misoprostol, prostaglandin E1 analog. So the common question they will ask you about misoprostol is it is contraindicated in what kind of patients? Contraindicated in pregnant patient because it was used in the past as abortifacient. It increases uterine contraction. PGE1 analog, which increase production excretion of gastric mucus barrier and decrease acid production. Sometimes used for NSAID-induced gastritis, but not commonly used. Adverse effect, this is the most common adverse effect they will ask you. That's the only question from misoprostol. Octreotide is a somatostatin analog, and we all know that somatostatin inhibit everything. It inhibits the secretion of various planktonic vasodilatory hormone. What is the use? Okay, we do use octreotide drip in varicose bleed. It can be used in acromegaly because it will decrease growth hormone. It can be used in lipoma because it inhibits secretion, carcinoid tumor. What is the side effect? Increased risk of gallstone because it inhibits cholecystokinin. Next is sulfasalazine. Sulfasalazine is a combination of sulfapyridine and amino salicylic acid. So once you take this medication is activated by colon bacteria. It is used in inflammatory bowel disease. The most common question they will ask you about this drug is side effect. Oligospermia. So they can give you a situation in which a couple is trying to get pregnant but not able to. Male has a history of inflammatory bowel disease. What kind of medication they are taking? So sulfasalazine will be your answer because it can cause oligospermia. Or what is your recommendation? Your recommendation will be to stop this medication. Loperamide is an agonist at mu receptor which decrease gut motility. Used in diarrhea, overuse can cause constipation. Loperamide is used in diarrhea, mu receptor agonist. Overuse can cause constipation. We use loperamide commonly in the hospital. Someone has diarrhea, once we rule out infectious etiology, if it is just watery diarrhea, we can use loperamide. Zofran, which is called ondansetron, again, this is a very common medication used all the time in the hospital. They will definitely ask you a question about this. It's a powerful centrally acting antiemetic. So what kind of receptor it blocks? They can ask you. The answer will be 5-hydroxytryptamine 3. What are the things you should worry about? With Zofran, it can cause prolonged QT prolongation, increase the risk of arrhythmia. It also increases the risk of serotonin syndrome. Metoclopramide. It increases GI motility. So let's say if someone has vomiting secondary to gastroparesis due to long-standing diabetes, then to increase the motility of the stomach, you can use this medication. It promotes gastric emptying. What are the side effects? It can cause Parkinson-like symptom. It can cause tardive dyskinesia. Orlistat, for some reason, they just love this medication for the exam. Orlistat. You'll definitely get question about this medication. So this medication inhibits gastric and pancreatic lipase, which decrease the absorption of fat. So if you inhibit pancreatic lipase enzyme, the fat will not be absorbed in the body, so it will be excreted out, and that's how people can lose weight sometime. So the use is for weight loss. Side effect: increased flatulence, increased bowel movement, decreased absorption of fat soluble vitamin A, D, E, K, which they can take orally. Eripitant. So less likely they will ask you any question about this drug. It's a substance P antagonist, block neurokinin receptor in the brain, used for antiemetic for chemotherapy induced vomiting, but now we have better drugs available.